up, we learn about the Standardized Patients Program established by Hualien Tzu Chi Hospital in Taiwan. We meet Wen Wenling, who initiated a change in the law to help patients needing bone marrow transplants. Welcome to our headlines. I'm Helen Liao. Thank you for joining us. In 2006, Hualien Tzu Chi Hospital established the first standardized patient center in Taiwan, in which standardized patients provide medical students with an opportunity to refine a variety of skills. Recently, the director of the center, Dr. Gao Shengbo, published the book Mastering Standardized Patients in hopes of fostering an uptake in the application and quality of the program.
This is a standardized patient who is trained to act as a real patient. To simulate a real medical scenario, the patient's wounds were done by a professional cosmetician.
In a real clinical setting, doctors often need to treat patients' wounds. Through this standardized patient program, trainee doctors can have a chance to hone their medical skills.
The standardized patient was played by a Tzu Chi volunteer who acts out a set of symptoms or problems for trainee doctors to work with.
The standardized patient program gives medical students a chance to practice their medical skills so that they will not get nervous when they are in a real clinical setting. Dr. Gao will organize all sorts of medical scenarios for us to act.
In 2006, Hualien Tzu Chi Hospital established the first standardized patient center in Taiwan, in hopes of bringing new inspiration to the training of future doctors.
Because our medical education has reached a new level, that is to say, we have to learn from our patients, who are our mentors, to help us refine our approach to patient care. This program provides our students with a controllable environment to practice their medical skills.
及时性，然后让他知道他什么地方是他的弱点。
Standardized patients are trained to realistically reproduce a physical or emotional medical scenario. To train Tzu Chi volunteers to become such patients, Dr. Gao Shengbo joined in a trainer's training program in the United States and later published the book Mastering Standardized Patients to help promote the program.
When I wrote this book, my purpose was to improve the quality and application of the standardized patient program in Taiwan.
As simulation treatments have been officially introduced in the national examination for doctors in Taiwan as of this year, Dr. Gao's new book will be serving as one of the most important learning materials for future doctors.
In Taiwan, on September 16, 64 orthopedic surgeons from 30 hospitals across the island arrived at the Tzu Chi Simulation Center to attend a neurospinal simulation surgery session. Thanks to selfless dedication of 8 silent mentors, these doctors all went home with new skills and knowledge. This is the scene at a simulation surgery center in Hualien, Taiwan. Today, 64 doctors across the island gathered together to learn from each other and 8 silent mentors. Passing on his experience to other doctors while carrying out a complicated spinal surgery, this is the chairman of Taiwan Spine Society, Yu Daijiu, who is also the director of the orthopedic department at the Hualien Tzu Chi Hospital.
Normally, this surgery will probably take around 7 to 8 hours to complete. Spinal osteotomy, such as removing a portion of the bone or spinal adjustment, is very challenging for many doctors.
Although Gao Yiran has been an orthopedic surgeon for 25 years, he still insists on attending these simulation surgeries as he hopes to bring newer techniques of minimal invasive surgery back to his practice in Taidong.
Right now in Taidong County, we need to focus on spinal surgery for senior patients. This is a very good opportunity for us to refresh our knowledge and skills.
This time, the simulation surgery was also joined by 11 doctors from the Chang'e Medical Hospital. For some of the doctors, this is their second time attending.
We don't want to make a long cut on patients. The silent mentors are giving us the chance to practice on their bodies, as they hope we can be prepared for every operation. I think it is very important to keep this concept in mind.
I think after today's session, maybe some of the doctors will have operations to do tomorrow. I think today's seminar has broadened their perspective, and it will definitely help them in the future.
The selfless dedication of the silent mentors has given these doctors the chance to improve their skills, thus benefiting their patients in the future. As Taiwan readies itself with the 4G network rollout, a number of significant changes may apply to users of smartphones, including the possible cancellation of unlimited data plans and adjustment of fee structure. In today's report, we take a look at how mobile users can get ready to embrace the 4G era.
Taiwanese have long enjoyed the benefits of unlimited internet access via their mobile phones on the 3G network. However, such data plans might be cancelled following the introduction of the 4G standard in Taiwan.
If that's the case, it would be very inconvenient for us.
Even with unlimited usage, we end up not using that much data. Instead, these plans often result in slower connectivity for everyone and wasted resources.
There are differing opinions regarding the benefits of unlimited usage. However, what is clear is that if your volume of use is not sufficiently high, the all-you-can-eat data plans are simply a waste of money and lead to increasing traffic congestion on existing networks.
Many mobile users later realize that they don't use that much data. They then explore alternative data plans that are more suitable for their needs. More and more users are switching to a 1 GB or 5 GB data cap now.
Currently, tiered data pricing is being explored by telecom carriers. Analysts suggest users to make use of smartphone apps which help monitor online data usage, so to choose a data plan most affordable for your needs. Mobile users also have to face the possibility that they may be required to purchase newer phone models equipped with 4G connectivity in order to access the network.
Yes, I will, of course. As you know, young people care most about network speed, so I think I will change it.
I want to wait and see how others find it. Then I will decide whether to get it or not.
Buy a phone based on your needs, as the 4G network is only expected to begin operation in 1 or 2 years' time. The phone you purchase now might not be compatible, so rather wait for 4G availability before you make your decision.
Industry professionals say as the bid for 4G licensing is still ongoing, there is no need for users to change their handsets at this stage, and it will take at least a year or two before the network is fully operational. Right now, focus should be placed on solving the increasing traffic problems on the existing network.
Users should make more use of Wi-Fi hotspots with the installation of micro base stations. If government entities can hasten the distribution of 4G licensing, this would be a long-term solution.
With the impending arrival of the 4th generation network, although Taiwan lags behind the global rollout, it is nevertheless a much anticipated development. However, the problem of heavy traffic on networks still needs to be resolved. Only if mobile users start changing their usage habits and ease the burden on mobile phone networks can we create a win-win situation for all.
In Taiwan, there are around 300 patients each year that receive bone marrow transplant. However, before 1993, a legal restriction stated that transplants could not be made to anyone outside 1/3 degree of kinship. Next to me, Wen Wenling, who is one of the forerunners in pushing for the establishment of a bone marrow registry.
We have 4 sisters. This is my elder sister. This is me. This is our 3rd sister, and this is the youngest. Wenling is the oldest. We are all very close, so all of us hoped we could be a match for her.
Wen Wenling can be said to be one of the forerunners in the push for Taiwan to establish a bone marrow donor bank. In 1992, while studying in the United States, Wen Wenling was diagnosed with leukemia at the age of 29. she was unable to find a suitable donor in the United States, nor within her own family.
When the last of us tested negative, I asked Dr. Chen if we can donate our bone marrow to others who might need it, like my sister, as the examination fee is so expensive. He replied that Taiwan has a real need for it, but one, the laws don't allow it, and secondly, Taiwan doesn't have a donor registry.
Back then in Taiwan, to prevent the trade of human organs, the law stated that only a 3 degree of kinship was allowable for transplants.
In order to help other patients like her to find a lifeline, in September 1992, Wen Wenling, along with National Taiwan University Hospital's laboratory medicine professor Chen Yaochang, asked the Ministry of Health and Welfare to revise those laws.
The Ministry of Health and Welfare and Executive Yuan were very cooperative in the matter, and they soon after revised the amendment and sent it to the Legislative Yuan for approval.
In May 1993, the restriction was eliminated and was also the debut of Taiwan's bone marrow donor registry. That same year, Wen Wenling, weak from illness, visited Master Zhen Yan.
骨髓营养库呢，必须要有一个赞助人，要有一个单位来去。
For this bone marrow donor registry to be useful, an organization was needed to help establish and push for registration. It needed an influential person in our society to spread this message, and they thought of our Master Zhen Yan.
推动这样的事情，所以他们就想到了我们的正元上人。
Therefore, in October 1993, the Tzu Chi Foundation established the Tzu Chi Stem Cell Center and began a campaign to register potential donors.
所以就有发动了第一次的这个。
For the first time ever, we started promoting the registering of donors. I recall it was first held at Bagua Mountain. The local Tzu Chi volunteers also came together to spread the message.
At the time, the act of donating bone marrow was foreign to most. But at Zhanghua's Bagua Mountain's first registry drive, over 840 enthusiasts responded. Within half a year, the donor bank increased to over 25,000 participants. Now, as of August this year, the list is at 370,000, with matches found for 3,300 patients in 28 countries. However, Tzu Chi volunteers continue their mission to reach more people.
The more people that are in the bone marrow donor bank, the higher the possibility of finding a match for a patient. So of course, we hope for more Samaritans to get involved.
Wen Wenling was eventually able to go through with her transplant surgery, but she was still not strong enough to fight off her illness and left the world. The stem cell registry she left behind, however, continues to change countless lives.
A stranger, a 19-year-old girl, was willing to donate her bone marrow to my sister. The whole time Wenling was sick, I hardly saw her shed tears about her illness, but when the blood marrow was being transferred to her, Wenling was moved to tears.
The age limit to donate bone marrow is set at 55 years of age. In 1997, Yang Shousha donated her bone marrow when she was 54 years and 2 months old. Although 4 years after the surgery, Yang received the news that her bone marrow recipient had passed away. Yang, who is now 71 years old, says that she has never regretted her decision to donate her bone marrow.
This is external alchemy cultivation. They do this all around the world. It's like a senior's exercise. There are even some 90-year-olds here. I am 71. There's something wrong with my back. I can't really bend my back. This exercise, the more gentle your movement, the better.
Doing exercise each morning is how Yang Shousha does her rehab for her injured back. Besides the back problem, there's another reason why she's cautious about her body.
I donated bone marrow when I was 54 and 2 months old. You can't donate once you turn 55. I was already suffering from osteoporosis in 1995. It was probably because I was quite old then, so it got worse later.
If there are things one would never regret doing in life, for Yang Shouxia, it was donating her bone marrow to save someone's life.
Every day I go out, I hold my back like this. Even when I walk, I didn't dare let go. It was just the thought that bone marrow saves lives, and that the procedure is not harmful to our body. I didn't know much. I didn't even know if I would be in danger or not, but I was prepared to donate under any circumstances.
On April 18, 1997, Yang traveled to Hualien Tzu Chi Hospital by herself, where she would become the 63rd bone marrow donor in the nation and the first cross-strait donor. Though not a person of many words, the kind-hearted woman had put her emotions in writing until a tape showed up one day.
I only knew that if the donation went successful, we would meet after a year. I kept waiting each year. I didn't know who to ask. I thought I would buy a necklace for him. This happened when I was in my 50s, so it seemed like I had given birth to a son.
We will always remember her act of love, Miss Zhang. We can only refer to her as Miss Zhang. We don't know her name. If we can find out her contact information, we can speak with her. She's like our son's second parent.
The Miss Zhang the recipient's family is referring to is Yang Shouxia. As the first cross-strait bone marrow donation case, Yang earned the name of Mother of the Island.
No one told me anything. It was not until 4 years later that a reporter found me and gave me this tape. I only found out then that he had passed away. I thought it was a pity.
I'm really grateful to her for donating her bone marrow. She saved my life. My family wishes her family a peaceful life. Good people deserve a life of harmony.
Unfortunately, Liu Jingquan passed away 2 months after the surgery. Today, Yang Shouxia still knows nothing about her recipient except for what she heard on the tape. Yet the words of gratitude and blessing from Liu have become Yang's fondest memory.
Every time I hear the word bone marrow, I feel truly proud and honored. It feels like I have been a part of something and it feels good. I am really happy. These clothes are still in good shape. It might just be out of fashion, so it got thrown away.
Having experienced the joy of giving and the impermanence of life, Yang Shouxia now devotes herself to recycling in hopes of inspiring others to give whenever they can.
Throughout the years, the Tzu Chi Stem Cell Center has helped countless patients around the globe to start a new life. In our next report, we go to South Africa to meet bone marrow recipient Amrit Singh, who regained his health thanks to the help of a kind donor from Taiwan. Inside this house, located in a community in Lenasia, South Africa, a family lives with gratitude every day. This is 45-year-old Amrit Singh, who is a devout Buddhist. He says that every day is a special day for him because he was once on the edge of death.
Firstly, obviously, when you diagnosed with an illness like this, is obviously acceptance. Initially, for the first couple of weeks, I denied it.
Why is me?
Why is it me?
In 2003, Amrit Singh found out that he was diagnosed with leukemia. Upon receiving the news, his family mobilized as they hoped to be matched as potential donors. Unfortunately, no one in his family was a match.
If there need to be anyone that's going to donate the bone marrow, it's going to be us. Because we're so close, and because we're siblings, everything will be a perfect match. And that was not the case. And I think for us, that was a big shock.
In February 2005, a 100% match was found in Thailand. However, just before the surgery, the donor changed his mind. In June of the same year, a donor was found in Taiwan, but the match was only 70%. despite the risk, Amrit Singh decided to give it a try. In July 2005, Amrit Singh underwent a bone marrow surgery which saved his life.
What it's taught me since I have recovered is to appreciate life. So sometimes cancer can be good.
Education.
Education. It can help you out, it can turn you around, it can help you to appreciate life, to live life to its fullest, and to see things.
My brother and myself, I like to thank the donor. He saved us a huge inconvenience.
And we're all excited to see and to know who's this donor that could have saved our brother's life. To this person and thank him. In South Africa, there's quite a few donors, and people don't understand. I think they're always thinking how painful it's going to be and what it's going to go through.
Thinking about the hardship her husband has gone through to regain his health, Kirti cannot help but shed tears of sadness. To reciprocate the love they have received, Amrit Singh's wife and eldest son decided to sign up as organ donors. The love from a Taiwanese man has given this family the chance to enjoy a healthy father and husband. From Asia to South Africa, now given a second chance in life, Amrit Singh says that the good affinity he has formed with his donor in Taiwan is a bond that he will never forget. Earlier in July in Tampines, Malaysia, Tzu Chi volunteer Ling Julan was seriously injured in a car accident. With no family nearby after leaving the hospital, Ling was instead cared by for her fellow Tzu Chi volunteers and neighbors. Here's more.
这口 OK 了哦，伤口很好，不会有泛脓啊。
Last July, Malaysia Tzu Chi volunteer Lin Julan was involved in a car accident. After Lin was released from the hospital, Danbian Tzu Chi volunteers took turns going to her home to care for her wounds.
There are no more signs of inflammation, and the wounds are slowly starting to heal.
Besides medical staff visits, every morning, rain or shine, volunteers from the neighborhood come to Lin's home to do housework or prepare meals. Some even visit several times a day to ensure the senior is fully cared for.
I just do my best to help wherever I can because she can't do it herself. She has no relatives or children to help her, so I thought I would help her.
Lin can't use her injured arms and legs, but with the help of her neighbors, she has been able to manage in daily life. Previously sowing good karma with her neighbors, now she is at the receiving end of their care.
She came over and cooked meals for me. I fell and my leg was in a cast. She's a person who is happy to help others. Whatever you need her to help you with, she will always do what she can.
The warm care and company given to Lin during this time has made her feel even closer to the volunteers.
Thank you all for coming to help me every day.
We go back to Taiwan at the end of the show. The 15th annual TIMA conference officially began on September 17th. This time the conference is joined by doctors and nurses from 21 countries as they hope to learn valuable experiences from each other. We'll leave you with these images. Thank you for watching Dai Headlines. Goodbye.